flavored ones, fruit flavored. Okay. Ready?
I'm ready.
Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Today we are going to talk about hormones and how they affect your health. And we're also going to talk about regenerative medicine procedures such as stem cells, amniotic tissue, ozone therapy, and some of the really cool stuff we're doing at Buckeye. So we're going to cut the break and we'll be right back.
Ready?
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. And I'm going to start off today. We're going to talk about hormones a little bit and about our endocrine system, more importantly. You know, and when we're on the show, we talk about the importance of testosterone, which is very important. But really, if someone's not feeling good, they don't have energy, having difficulty sleeping, mental fog, low libido, aches and pains, you know, all these symptoms we talk about all the time that are often associated with low testosterone, it's important to understand that it could be testosterone, but it could also be some other things, you know. And it's really about a balancing act. So that's why, you know, a lot of times people will just get on testosterone and feel no better. You know, so it's very important if you're going to do hormone replacement therapy, or more importantly, what we do is anti-aging, that you really look at the endocrine system as a whole and not just testosterone, because that's just one piece of the puzzle. You know, and all those symptoms we talk about, lack of energy, putting on weight, aches and pains, difficulty sleeping, it really can be tied back to 6 key things. You know, and number one is testosterone, very important. But just as important is and this is in males and females, is estrogen and progesterone. Guys and girls both have to have estrogen, obviously different levels of estrogen, but this is something that's often overlooked, and it actually amazes me. A lot of times we'll have people come into the office that are doing testosterone therapy somewhere else, and I'll ask them, you know, and they're not feeling well, that's why they're at our office, and I'll say, well, how's your estrogen doing? And they'll say, my doctor doesn't test that, or my doctor doesn't, I mean, I've heard this, my doctor doesn't believe in estrogen. Well, it's not a religion. You don't believe in it or not, you have it. But it's very important if you're on any type of hormone replacement therapy that estrogen has to be regulated and monitored. And what I often see is, number one, they don't even look at it, and the person's estrogen is through the roof. A typical sign of that would be, you know, they put on weight, they get bloated, their nipple tenderness. You know, and if you're on hormones and you have these symptoms, it's probably because your estrogen's out of hand. And testosterone itself is very safe, but high estrogen causes lots of health issues. So if you're on testosterone replacement therapy somewhere other than Buckeye, and I'm not watching your estrogen, and you feel like you put on weight, or you're bloated, or you have nipple tenderness, it could be dangerous. It could be very dangerous, and highly recommend that you get your estrogen levels checked, male or female. Now, in the reverse, I've seen too. So sometimes these people will say, well, I went to my doctor, I listened to your radio show, and I had these symptoms, so they put me on an estrogen blocker. And I'll say, well, you know, how much were you taking? And they're usually way overdosed on estrogen blockers. And I've had several guys come in that have no estrogen. And estrogen is essential for your bone and joint health. It's for what they call osteoblastic activity. And basically what osteoblasts do, they're the cells in your body that build bone, cartilage, tendon, and ligament. If you have no estrogen, your bones will degenerate and become osteoporotic. That's why females, when they hit menopause, become osteoporotic. Your joints will ache you all the time. Estrogen is also very important for libido. So as you can see, it's a balancing act. And that's why at Buckeye, when you come in, we test all these levels every 20 weeks. Because the other thing people got to realize is typically when you put a male or female in hormone replacement therapy, your body composition is going to change. And typically you'll lose body fat, and usually a substantial amount of body fat. The less body fat a person has, the less estrogen they're going to have, because estrogen, a lot of it is metabolized in a person's body fat. So heavier people in general have more estrogen. But as you, if you're testosterone deficient or hormone deficient, and you come to Buckeye and your body composition changes and you lose body fat, how we manage your estrogen will change too. So, and that's very, very important. And that's why anyone on hormone replacement therapy has to get blood work done at least every 20 weeks. Because your body composition changes, and as it changes, your levels of testosterone, estrogen, progesterone, growth hormone, those change too. So very important to monitor those things. Progesterone is another hormone that's also essential to regulate and monitor in males and females. Typical signs of progesterone deficiency would be difficulty sleeping. Progesterone is essential for sleep, and if you're listening to the show, and there's so many people I hear out there that, once they hit 35, 40 years old, they'll just say their sleep's terrible. My sleep stinks. Well, if you're not sleeping good, you're not healing good. And if you're not healing good, you're tired the next day, you're less likely to work out, so it starts to affect your metabolism and you start putting on weight. That's kind of the hallmark of aging. So you have to sleep. Everyone has to sleep, and sleep means a good restful sleep, 7, 8, 9 hours a night. And if you're not able to do that, and you're having difficulty, progesterone is one of the first places we'll look. And very simple to take bioidentical progesterone. And one thing that I want to be clear on here too is there is a synthetic progesterone out there that's prescribed to a lot of people, and that's called Provera. Provera is not progesterone. Provera is a drug that mimics progesterone. Provera has lots of side effects, some of them dangerous. So if you're on Provera, go to your doctor and say you don't want to take the drug, you want the real thing, you want the bioidentical progesterone, like we do at Buckeye. No side effects. I was doing a lecture 2 nights ago, and there was a lady in the audience, and we were talking about testosterone therapy and estrogen therapy, and she's like, "Well, I'm on an estrogen patch. It's estrogen." And I was like, "Well, you sure it's bioidentical?" She's like, "I'm not really sure." Well, what I recommend is if you are on what your doctor told you is estrogen or testosterone or progesterone, how do you determine whether or not it's a bioidentical? And what a bioidentical is identical to what your body produces, or a drug that mimics that hormone. Well, it's pretty simple. If it's a medication, it's going to come with a huge list of side effects. If it's a bioidentical, there'll be no side effects. There's not going to be anything in directions that list side effects. So if you are on what you think is estrogen or progesterone or testosterone, but when you pull the bottle out and there's a huge list of things, and that parchment paper that comes out with all these side effects on it, it's not bioidentical. It's a drug that mimics, and this is what I keep harping on. It's dangerous, not effective. And just go to your doctor or work on the Buckeye and say you want bioidentical, you don't want the side effects, you want the real thing. And at this point, you can't even debate whether or not hormone replacement therapy is safe. It's not even debatable. Any long-term study using bioidenticals proves this. There's not one study out there that has bioidentical hormones that says it's unsafe. Now, there are studies out there that look at, Premarin and Provera. These are synthetics, or these are drugs that mimic hormones that show they're dangerous, and I'm in agreement with that. But bioidentical hormones are safe and effective, and it's proven time and time again. And you won't find a study out there anywhere that proves different. So it's not even debatable. What else is important to look at? So we talked about testosterone, we talked about estrogen, we talked about progesterone in males and females. Another key thing that we have to look at is growth hormone. Now, growth hormone converts to IGF-1 in the liver, so the way we regulate it is with your IGF-1 levels. Why growth hormone is essential is growth hormone is directly related to connective tissue strength. So how does that benefit you? Well, connective tissue is your hair, your skin, but more important than that, it's also your vascular supply, your arteries, your veins, your heart. These are all connective tissues. And that you want these things strong, in particular as you get older. And there's lots of research out there that proves this. One of the best indicators of someone who's going to have heart disease is low growth hormone levels. Well, why would that be? Well, because if your connective tissue weakens and your heart stretches out, obviously that leads to problems. Or as you get older, if your blood vessels stretch out because of low growth hormone, another hallmark. So it's actually one of the best indicators or predictors of heart disease is this growth hormone level. And this is something we look at Buckeye. And one thing you do have to realize is if you have low testosterone, you're going to have low growth hormone 90% of the time, because testosterone in males and females is synergistic with growth hormone. And a lot of times people will come in and they'll have low testosterone, low growth hormone, and they'll have heard a show and they'll say, well, I want to do both. And if your testosterone and estrogen and progesterone are messed up, step one is you fix those. Because often we find when we fix those levels in males and females, the person's growth hormone level comes up anyways, and they don't need to take anything for growth hormone. So usually we like to get everything balanced out and then go back and we'll check that growth hormone after they've been on the program for 20 or 40 weeks. And 9 times out of 10, the growth hormone levels are fine. But if not, there are options out there. So I'm going to cut the break, and when we come back, we're going to delve into a little bit about growth hormone and how important that is and how we can fix it.
And you can, how can you fix it? Get your blood work done.
Get your blood work done. Yours will come up, I bet.
Oh, sure. I'm sure it will after, about 4 or 5 weeks. You'll see the levels start to increase.
How many weeks are we on right now?
This will be the 3rd shot.
That's it?
Yeah, that's it. Seems like more.
It
And I
does.
did take the little shot with the small syringe, the insulin needle.
HCG.
I took that. Yeah, I took that on Tuesday and Wednesday. So I did that like I was supposed to. Okay, ready to go?
I'm ready to roll.
Okay, here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. And we were talking about the key hormones that people need to regulate, and it's not just testosterone. There's many other things that are important to regulate as we get older if you really want to do anti-aging. And we were talking about growth hormone levels, and we check growth hormone levels every 20 weeks if you're an anti-aging patient at Buckeye. The reason we do that is it's essential for your connective tissue, which is not only important for your skin and your hair, but also for your heart and all your blood vessels, all your joints. Keeping these levels up keep these tissues very healthy, and will help you not only live longer but feel a lot better. If someone's growth hormone levels or IGF-1 does not go up once we get their regular hormones with the estrogen, testosterone, and progesterone balanced out, there are options out there to increase your growth hormone levels. And the first option I'm going to talk about is an option that we do not do at Buckeye, and I'll kind of go over why, and that is we do not prescribe synthetic growth hormone. Once again, at Buckeye, we don't do anything synthetic. The body knows it's synthetic, and anytime you're messing with synthetic things, whether it's synthetic growth hormone, synthetic testosterone, synthetic estrogen, synthetic progesterone, there are going to be side effects. That's why when you pull the bottle out, there's this big parchment paper with a bunch of stuff. So we just don't do it. The other problem with synthetic growth hormone, on top of the side effects, which are numerous, it's cost prohibitive. It's very expensive to take a therapeutic dose of synthetic growth hormone, something that would actually benefit the patient. The cost on that would be about $2,000 a month. Now, obviously, some movie star actors can do this stuff, but the general person can't afford $2,000 a month. And the other thing you got to keep in mind with synthetic growth hormone is it works on a negative feedback, just like testosterone does. So if you're taking synthetic growth hormone, your own pituitary gland, which secretes the growth hormone, will quit producing. So if you ever stop taking growth hormone in the future, what will happen is you'll be left with no growth hormone. And when that happens, if you have declining growth hormone levels, kind of like we talked about earlier, your chance of heart disease and heart attack goes up exponentially. So we just won't do it. A better option for a person that has low growth hormone levels is a peptide that we prescribe, and it's called Somorelin, and we mix that with another peptide called GHRP2. And basically what these have been safely used since the 70s. They were actually developed originally for people that had dwarf children. If someone's a dwarf, it basically means their pituitary is not producing a lot of growth hormone. But what they found is they didn't want to give these children synthetic growth hormone because they'd have to take it the rest of their life. So Somorelin was developed, and what Somorelin does is it basically gets your own pituitary to produce more growth hormone. So as we get older and your pituitary starts producing less, taking this just simply stimulates your own pituitary to return to youthful levels. Think of it as a vitamin or a nutrient for your pituitary. There's no negative feedback. If you ever stop, your pituitary goes back to where it is. And the results are amazing. So if you're sitting listening and saying, well, how would I know if my growth hormone levels are compromised? Well, number one, blood work never lies. So when you come to Buckeye, we'll look and tell you, and we'll see it. But if you're not there yet, another telltale sign in males and females is body fat around the abdomen or difficulty losing weight. Growth hormone is essential for fat metabolism. And one of the reasons people, as they get older, you're eating the same foods or less foods, but you start putting on body fat, is that decrease in growth hormone levels. If your hair is thinning out, growth hormone levels. If you notice your skin starting to hang or get saggy, growth hormone levels. And these are all things that can be corrected and treated with anti-aging like we do at Buckeye. But once again, everything kind of circles back and starts with blood work. Along those lines, too, we're talking about negative feedback. I do want to circle back to testosterone. Another thing that we quite often see at Buckeye is people on testosterone replacement therapy just taking testosterone and not taking anything to boost their own hormonal system. If you're taking just testosterone, and you're not taking HCG, which is human chorionic gonadotropin, with it, you are destroying your own body's ability to produce testosterone. Because what your body will do is realize that, hey, I don't need to make it. We're taking this from some other way, whether it's a gel, an injection, or a pellet, and your body will literally quit producing. And if you're listening, for men, one of the things you would notice right away is testicular atrophy, because the majority of your testosterone is produced in the testicles. If those are decreasing, that's a telltale sign. And the problem that you will run into is if you ever decide to get off hormones, if you're taking just injections or gels or something in your primary care or wherever you're taking it, your body won't be producing any. So the health issue you had when you started will be even worse. So at Buckeye, the only way we would even prescribe testosterone to a person is they have to take HCG with it. And that's human chorionic gonadotropin. Don't confuse that with growth hormone. It's different. But this human chorionic gonadotropin stimulates your body to produce more testosterone on its own. So if you come to Buckeye and you're a male and you have low testosterone, we treat it from both sides. We, number one, give you the HCG to get your body to produce more on its own. And then number two, if you need it, we'll give you testosterone, extra testosterone to boost your body up to get you to those optimal levels, a normal 25 to 30-year-old healthy male, because that's where you want to be. So if you're doing hormones anywhere else and you're not taking HCG as a male, ask your doctor for HCG or come to Buckeye. But if you're not taking it, you're putting yourself in a situation in the future if you ever decide to get off. The other things that are very important to look at is vitamin D levels. We live in Ohio, and I have guys that golf every day. In the summertime, I have landscaping guys that come in. If you're not taking a vitamin D supplement and you live in Ohio, you will be vitamin D deficient, period. We just don't get enough hot sun here. We just don't. I don't care how much you're outside or how tan you are. And this is for all races, white, black, Mexican, it doesn't matter. Everyone needs vitamin D. Vitamin D is really not even a vitamin. It should be classified as a hormone, but it's classified as a vitamin. But it's essential for your endocrine system, for your for all of your healing, for your immune system. There's studies out there directly relating vitamin D deficiency to cancer. Vitamin D is very inexpensive to take. It's very simple to take. No one has an excuse to be vitamin D deficient, and that's something we check on every single patient at Buckeye, because it's really easy to fix those levels. And we can fix your testosterone and estrogen and growth hormone and everything. If you're vitamin D deficient, you're still going to feel terrible every single time. It's that important. So that's something that's very important to look at, whether you're treating a Buckeye or not, to make sure those are at their optimal levels. And the other thing I'll tell you is if you go to, we always harp on the difference between normal and optimal. So normal vitamin D levels on a blood work is above 30. But I'll tell you what the research says, anything below 60 is not optimal. You want those levels above 60. That's where you're going to get the anti-cancer and the hormonal benefit and the well-being benefit. So if your doctor says your vitamin D is normal, you want to look at it yourself. You want that level above 60 for sure. Another important hormone to look at is thyroid. Lots of people have thyroid issues, and the thyroid is very complicated, but it has to be looked at in anyone doing any type of anti-aging program, because if your thyroid's messed up or not functioning properly, or you're not using your thyroid hormones properly, you're not going to feel right, your metabolism will be slow, you'll put on weight, and you'll be sluggish. So very, very important. Now, your thyroid actually produces two things. Your thyroid produces T4, and it also produces T3. 80% T4, 20% T3. But here's the problem. T4, which is what 80% of what comes out of your thyroid, is useless. So then metabolically, you have to break T4 down into T3 to use it. And that's where the problem lies with most. Because of nutritional deficiencies, we live in a fast society and a lot of people don't eat properly. If you don't have proper nutrients, your body won't break down that T4 into T3, and then you won't have, which in essence means you have no thyroid hormone to use. And unfortunately, what happens often is a person will go to their doctor. The doctor will look at their thyroid levels and say, well, you don't have enough T3. We're going to put you on some synthetic. We'll put you on some synthetic thyroid, and that'll fix the problem. Well, once again, that thyroid works on a negative feedback, as most hormones do. Once you start taking thyroid, if you take it consistently, you're going to have to take it the rest of your life. And oftentimes, what we find at Buckeye is when you look at these levels, you're producing enough thyroid, you're just metabolically not breaking it down because of nutritional deficiencies. So before we put you on any type of thyroid medication, why not give you the nutrients to get your T4 down to break down into T3 so you're not messing with your thyroid at all? So we look at every patient that comes to Buckeye, and the majority of people that have quote-unquote thyroid issues, they're not thyroid issues, they're metabolic issues because of improper nutrition. And there's some really easy, simple supplements to take, and we can tell by your blood work that correct this problem. So without getting on thyroid, with thyroid medication, take a thyroid supplement that basically gets your body to break that T4 into T3, and you actually have usable thyroid, is a much, much better solution. And the final thing we'll talk about will be insulin. Insulin is the most anabolic hormone of all, also directly tied to how you feel and your health. And, type 2 diabetic is pandemic in our society. More and more people have it. My father passed away from type 2 diabetes, so it can kill you. So it's very important to look at your insulin levels and make sure you're not, pre-diabetic or anything like that, because if you are, that's once again something that can be handled through nutrition. Taking medication for insulin, if you haven't done at least nutritional or change your diet first, doesn't make a whole lot of sense. You start taking, metformin, and then it goes to the, up the chain as far as medications. The next thing you know, on insulin, your body quits producing it, and you have to take more and more for the rest of your life. So that's another thing. When you come to Buckeye, we'll look at your blood work, and if you're a pre-diabetic or type 2 diabetic, we'll talk about nutrition, give you some options other than taking a hormone for it to try to correct the problem without taking medications. So to circle back, so at Buckeye we do anti-aging. We're not a low T place or whatever, because that doesn't make a whole lot of sense. If someone's just looking at your testosterone levels and they don't look at your estrogen or progesterone or growth hormone, vitamin D, thyroid, or insulin, you're not even looking at the whole picture. It doesn't even make sense. So any good anti-aging person is going to look at all 6 of these components and look at you as a whole and tell you, and get all of those to optimal levels, not just testosterone. And that's what we do at Buckeye. And the other thing they're going to have to do is you've got to get blood work if you're on any type of hormones every 20 weeks at least. Because if you're doing hormone replacement therapy properly or anti-aging properly, your body will change. You're going to lose body fat, you're going to gain muscle, which will change the dosage of the hormones. And if these aren't closely watched, it just doesn't work. So hopefully if anyone's listening there and you're not doing it properly, you either get with your doctor and say, hey, I want my estrogen, progesterone levels, my growth hormone levels, my vitamin D, thyroid, insulin, also not just testosterone, and make sure they're doing a good job of managing those things. And you need all of them, whether you're a male or a female. All of these hormones are essential. And I've said it before and I'll say it again. Anybody who is deficient in any of these hormones is crazy not to treat. You feel better. It's going to help you live longer. It's not even, people say, is this elective? It's not even elective. It's mandatory. If you plan on being on this earth for a long time and living a healthy life and growing old and being healthy and not having pain, you're going to have to address your hormone system at some point. And that's usually around 35 to 40 years of age. But there's some people in their 20s that have issues, and there's some people that can make it to their 40s or 50s. Get your blood work done. So that's pretty much it for today. I hope if you're listening, you picked up on some things there. I do want to kind of wrap up. We talked about hormones today and the importance of all that stuff. I also want to plug another thing we've been doing at Buckeye with great success, and we're doing a lot of stem cell procedures and allographic procedures for pain. We love treating pain patients at Buckeye. Most doctors don't like treating pain patients because traditional medicine doesn't have a whole lot of solutions for pain. But at Buckeye, hormones help pain. We have shockwave therapy. We have high-power laser therapy, ozone therapy, PRP, stem cell allografts. These are all things that actually fix pain. And as a physician, nothing makes us feel better than getting people better and seeing results. And for most doctors that treat pain or pain management, it's kind of a dead-end street. They're taking cortisone injections or opioids. That never fixes anything. And for these doctors, it's rough because you're just watching the person degenerate over time. Now, Buckeye, we don't address it that way. If you come to Buckeye and you're suffering with chronic pain, we're going to look at your endocrine system, see why you're not healing, and address the problem, not just mask the problem. There's a huge difference with that. So if you've been on here and you're suffering with pain, and you think you don't have hope, mention the radio show. You can come in. It doesn't cost anything for a consultation to sit down. Myself or one of the doctors will sit down with you as long as we need. Give you a half hour, 45 minutes of our time, whatever it's going to take to talk about your case. When's the last time your doctor gave you 30 minutes of his time? You're going to get that if you come to Buckeye. You'll see multiple providers. We have medical providers. We do traditional medicine, chiropractic, physical therapy. We do it all there. So we have it all under one roof. So if you're suffering with pain or know someone suffering, tell them to mention the show, come into Buckeye, at least give it a chance. You have nothing to lose. It's not going to cost you anything. But anyways, this is Dr. Buzz with Buckeye Physical Medicine Rehab. That's BuckeyePMR.com is the website. Please, if you haven't got your blood work done and you have any of those symptoms, come in. Or if you know someone suffering with pain, we'd love to help. We can't help you if you don't come in, though. Until next time.
Right on.